Hello everyone, this is Dr. Sankari Kasi. I am a primary care physician and I am family medicine board certified. Welcome to my YouTube channel. Today I'm going to talk about a common, interesting and one of my passionate topic, that is perimenopause. I am going to do a separate video for menopause and postmenopausal treatment options as well as the symptoms of menopause. But in this video, I'm going to discuss about perimenopause, how do you identify perimenopause, what to expect in your doctor office visit, and what are all the treatment options available, and what are all the diet as well as the lifestyle changes that we can do for the perimenopause. This is one of a major life transition event, especially the perimenopause, and I want to make sure that you got all the right information for you. So let's start with what is perimenopause. So perimenopause is 7 to 10 years before the onset of menopause. Menopause is 12 months of no periods, and average age for menopause is 51. Perimenopause is 45 to 55. That age range is the perimenopause. And if you look at the symptoms of perimenopause, it could be a wide variety of symptoms. Some patients are very frustrated because you just get skin changes, hair changes, weight gain. Haven't done anything wrong, doctor, but I have been gaining so much weight. I have belly fat, I have brain fog, I have irregular vaginal bleeding, periods, anxiety, mood changes, lot of sweats, insomnia. And sometimes patients would tell me, doctor, I have seen multiple doctors, I've seen multiple specialists, my lab test is all normal, it's not me, there is something going on, what is it? So this could be your perimenopause. So let's identify what are all the symptoms. So everybody's body is so unique. Some of them have some symptoms and some of them may have a variety of other different symptoms. So it could be painful acne, skin changes, hair fall, weight gain, belly fat, and some of them may have heavy vaginal bleeding or less vaginal bleeding or irregular vaginal bleeding. Some of them will also have hot flashes, very big amount of night sweats causing them the insomnia, mood changes, right? Like they have anxiety, depression, or like very overwhelming, stressed out, and also they can also go through the brain fog. So there are different symptoms that could happen during this period. So before you go see a doctor, let's have a strategy. Okay, I would recommend you to write down all of your symptoms in a journal. Make sure to write down everything. If you have joint aches, muscle aches, body fatigue, hair fall, anything that we discussed about right now, this could be your perimenopausal symptoms. Make sure that you write down all of your symptoms. The second one I would recommend is write down your family history. If there is any thyroid disorders running in the family, if there is any family history of heart attack, stroke, high blood pressure, clotting disorders, or blood clots, then I would just write all of those down. And then also think about it, if you want hormonal options or non-hormonal options. And then when you go to your doctor, it will be easier for you to narrow down what questions you can ask for. So what are all the treatment options that is available in perimenopause? So let's talk about the Women's Health Initiative. So they published an initiative in 2002. They include women in their age range of 50 to 79. So they released a study data stating that when patients were placed on hormone replacement therapy, there was increased risk of invasive breast cancer, heart attack, and stroke. So it was very terrifying at the moment when the study came in. So when we joined the practice at the time, so we were all asked to stop the hormones for the patients. I remember personally calling all the patients who are on the hormones. We helped them to taper it, and then we also stopped the hormones at that point. So there is a decade of women who are not placed on hormones at all. 18 years later, so the Women's Health Initiative released that. So the risk was higher because older women were included in the studies, and that's the reason that the risk were higher. But if the patient is younger, if they are in their 50s or if they are within the 10 years of menopause, they are actually benefiting from the hormonal replacement therapy. So this was a big game changer. So this changed everything. So now patients can be on the hormone replacement therapy, but I would encourage you to talk to your primary care provider or your women's health specialist to see whether you will be a fit or the right candidate for the hormone replacement therapy. So let's look into the hormonal treatment options for the perimenopause. The number one would be the low dose contraceptive pill. And the second one would be either IUD, Mirena. On top of it, we can give you the estradiol patch. And we have different strength available. We can optimize the right dose for you. So make sure to talk to your healthcare provider whether you would be a candidate for the hormone replacement therapy. And depending upon your individualized discussion, they can provide you the appropriate treatment for you. And then FDA has approved those hormonal replacement therapy for patients if they are having hot flashes, night sweats, and also genitourinary syndrome of menopause. If they are someone having a recurrent urinary infection, they can also get the hormone replacement therapy. And very minor or few patients that go through premature menopause, they can also get the hormone replacement therapy. The fourth indication will be if women who are at a high risk for a bone loss, they could also benefit from the hormone replacement therapy. What are all the non-hormonal replacement therapy options available? The number one symptom is hot flashes, night sweats. Other options would be SSRI, SNRI, or gabapentin. There is also a latest medication available in the market for the hot flashes in perimenopause. So make sure you talk to your provider whether you are a candidate for that. We can look into the lifestyle as well as the diet modifications that are available. So this is a common question. A lot of us ask me that how much of exercise is needed, because weight gain is a big thing that can happen in the perimenopause as well as the menopause. A lot of belly fat, even though they have been doing all the right things, it's difficult to lose weight. So ideally we say 60 minutes of exercises 3 to 5 days per week is ideal for us to maintain the weight, right? But it's difficult for you to do those 60 minutes of exercises 5 days a week. At least try to stay active as much as possible. I would advise after every meal, like lunchtime or dinner time, like 20 to 30 minutes, 2 to 3 times per day, or even after every meal if you can walk, or even if you take a short walks, like 10 minutes walk multiple times throughout the day, it still keeps you active. That's the best. I understand that women in their 40s and 50s, they are in the highest point in their career. They are like working, they have a lot of responsibilities, kids are growing, they have to take care of their elderly parents. So sometimes it's difficult to get the downtime for them to exercise at a certain set. But I tell them, try the best, even short walks, short exercises in between the day. If you drop your kids to your games or sporting events or anything like that, make sure you have those time to get those small walks so that you keep in best of your health. The next important question is diet. What are all the diet that you could follow during the perimenopause and menopause? So during the perimenopause transition, so there is a down slope of the estrogen. So estrogen level is going down. Estrogen is an anti-inflammatory hormone, so our inflammation level goes up, right? So that's why we are having all those symptoms. There are two diets which is recommended. Number one is intermittent fasting. Number two is Mediterranean diet. Both of them are anti-inflammatory diet. So intermittent fasting is 16 hours of no food and then 8-hour window that you can eat the food. Some patients it works the best, the intermittent fasting, go for it. If you are one of those patients, just go for the anti-inflammatory, which is the intermittent fasting diet. Another set of patients, if that does not work out, then anti-inflammatory diet, the Mediterranean diet is also helpful. So the Mediterranean diet is mostly whole grains, fresh fruits, vegetables, mostly plant-based. Fish is also included. So this is also another diet that you can try. And definitely somebody who has a cardiovascular diseases, this Mediterranean diet will also be helpful for them. Other supplements that you can take during the perimenopause and menopause. I would encourage you to first talk to your provider and have your labs checked, like a complete blood count, thyroid, vitamin D, vitamin B12 level. Have a basic blood test done, and depending upon which of the vitamins are low, then they can always substitute more of those supplements for you. Other patients, usually for insomnia, they take magnesium. Magnesium has got two effects. One is it has got a calming effect. The second one, it also increases melatonin production. So it helps you with the sleep. So you can also take magnesium as for your sleep related issues as well. So today we have reviewed what is perimenopause, what is the hormonal treatment options, non-hormonal, what are the diet that you can follow, what are all the supplements, and how much of exercise that's all needed. And I hope this will be very helpful and useful for you when you are going through this major transition in this life. When you go to your provider next time, if you find this video it is helpful, and then also make sure to leave a comment like how did your visit with your doctor go, and make sure to leave your comment if you have tried some of the supplements and diet, if it has been helpful for you. Thank you for watching, and make sure to subscribe to my channel so that you can get the future updates. I hope to see you all in the next video.